Kussmaul sign. It's the paradoxical rise in jugular venous pressure during inspiration. Jugular venous pressure is the undulant top of oscillating blood column in right internal jugular vein, which represent volume and pressure changes in the right side of the heart. So we have seen in previous video how to measure JVP and different waves of JVP. So there will be three ascending waves and two descending waves. Now let's look at why we get Kussmaul sign. In a normal individual, JVP falls in column level during inspiration. So when a person inspires, so a person inspires, remember it as increase in negative intrathoracic pressure. So because of this intrathoracic pressure, because of this, there will be increased venous return to right side of the heart. So if this is the heart, this is the right atrium, there will be increased venous return to the right side of the heart. So because of this, there will be, when the blood comes down to right atrium, the column of JVP falls down during inspiration. This is a basic logic. This is also accommodated by inspiratory decrease in pulmonary vascular resistance, because during inspiration the chest expands and the pulmonary circulation is not that compressed. Like during expiration, the pulmonary circulation is compressed by the thoracic cage, but here when the thoracic cage expands, it doesn't get compressed. So there will be decrease in the vascular resistance, pulmonary vascular resistance. Therefore the pulmonary artery and right ventricular pressure falls despite increase in venous return. Despite increase in venous return, there will be fall in JVP level. And normally during expiration, there will be positive intrathoracic pressure. The pulmonary circulation is compressed by the thoracic cage. This causes increase in pulmonary vascular resistance and increase in the pressure. Causes of small sign. So as I have explained, so if this is the heart, this is the right atrium, right ventricle, and this is the vein, right internal jugular vein. So when this is linked directly to the right side, so any changes in the right side of the heart, any abnormalities, any difficulty or any disorders of the right side of the heart, we get this Kussmaul sign. So right ventricular infarction, severe right-sided heart failure. So without fail, do remember severe right-sided heart failure. Right-sided heart failure, one of the main symptom is Kussmaul sign. Then we have acute severe asthma, constrictive pericarditis, restrictive cardiomyopathy, and rarely we get tricuspid stenosis and regurgitation. So why during these conditions we get Kussmaul sign? Let's see at it. As we have seen in above condition, for example, right-sided heart failure, right-sided infarct, RV, right ventricular infarction, there is increased venous return, which is normally seen in normal individual during inspiration. This increased venous return cannot be accommodated by heart. So when the heart has a problem, that is on the right side, or during constrictive pericarditis or restrictive cardiomyopathy, it cannot accommodate this increased venous return, which leads to translation of venous blood back to SVC. So if this is the heart, this is superior vena cava SVC, the right side, this is the right atrium, RV, right ventricle. Increased venous return cannot be accommodated by heart. So there is translation of venous blood back to SVC, back through SVC. So this will be increase in JVP level. This present as distended jugular vein. So the jugular vein will be distended even during inspiration. And to summarize it, learn about JVP, understand the basics how JVP works, then what are the mechanism during inspiration and expiration in a normal individual, how does JVP level varies, and then look at the causes of Kussmaul sign, and finally understand how it happens.